people don't die from diseases that are preventable with vaccinations. Science is getting close to eradicating many different infections. Someday there may even be a vaccine for the common cold. Now imagine that parents opt not to vaccinate their children against these diseases because they fear the risks outweigh the benefits. Then, once rarely seen diseases will make a comeback. According to the World Health Organization, a vaccine is any preparation intended to produce immunity to a disease by stimulating the production of antibodies. The most common method for administering vaccines is by injection, but some are given by mouth or by nasal spray. If you vaccinate your children according to the recommended timeline by the American Pediatric Association, you can prevent your children from getting severe preventable infections. Certain diseases may eventually become eradicated, and you may save them from getting other related infections or diseases in the future. I want to provide you with information on the importance of vaccinations, the most common myths surrounding vaccinations, and how vaccinating now can affect the future. I will begin by telling you about the importance of vaccinations. Vaccinating your child is a safe and effective way to ensure a low risk of contracting certain illnesses. According to the Department of Health for the state of New York, the threat of death by disease isn't the only medical consequence of skipping vaccinations. Unvaccinated children require special medical procedures and treatment when they become ill. Because the majority of the population is vaccinated, health professionals may be unfamiliar or inexperienced with these treatments. Some people are unable to be vaccinated because they are severely immunocompromised. Instead, they rely on the general population to be vaccinated. Every time your child becomes ill, you put these people at risk. Pregnant women who are not vaccinated are vulnerable to certain infections that could complicate the pregnancy. For example, contracting rubella in the first trimester can cause a syndrome that can in turn cause heart defects, developmental delays, and deafness. There are also social implications from non-vaccination. A child who is not vaccinated and becomes ill or is exposed to a certain infection may require quarantine from the general public, family, and friends. If there is an outbreak in the community, a child may be asked to leave school or other activities for an extended period of time. If you vaccinate your children, the incidence of certain diseases is very low. According to the CDC, there are 28 vaccine-preventable diseases. According to vaccines.gov, vaccines are very safe and effective. Vaccines are only given to children after a long and careful review by scientists, doctors, and healthcare professionals. Next, I will tell you about one of the most common persisting myths surrounding vaccinations. Many parents are fearful of vaccinating their children because of a late 1990s study that linked vaccinations to the development of autism. According to the Huffington Post, in 1998, Dr. Andrew Wakefield published a study in a British medical journal proposing a link between the MMR vaccine, gastrointestinal problems, and autism. Fiona Godley, the journal's editor-in-chief, says, "It's one thing to have a bad study. In this case, we have a very different picture of what seems to be a deliberate attempt to create an impression that there was a link by falsifying the data." According to the Huffington Post, the medical histories of the 12 children in the study had been altered or misrepresented. Wakefield claimed that all of the children were normal until the vaccine. However, it was proved that 5 of them had previously documented developmental delays. Timelines were falsified to create the appearance of cause and effect. Children had been subjected to unnecessary procedures. The findings of the study have never been able to be confirmed or reproduced by other researchers. 10 other authors of the study withdrew their names from it in 2004. Investigations into Wakefield's methods by the British General Medical Council proved dozens of charges against him, including dishonesty and ethical violations, including abuse of developmentally challenged children. The study was also formally retracted by the medical journal that originally published it. The investigation by reporter Brian Deere revealed payments to Wakefield in excess of $674,000 from lawyers who were preparing lawsuits against drug companies that manufactured the vaccines, creating experimenter bias even before the study began. In addition, Deere reported that Dr. Wakefield had filed a patent for a new measles vaccine and proposed to develop a new company that would develop new diagnostic tests and therapeutics, including vaccines. In 2010, the GMC banned Wakefield from practicing medicine in Britain. According to the CDC, a study done by the Institute of Medicine found that the evidence favors rejection of a causal relationship between vaccines and autism. Lastly, I will tell you how vaccinating your children now can have implications for the future. Vaccinations against particular disease can help protect against future health problems, as well as eventually leading to eradication of certain serious diseases. According to the CDC, there are two types of vaccines that are effective in preventing HPV-16 and HPV-18, the two most common types of HPV known to cause cervical cancer. By getting the vaccine and preventing these types of HPV, you can prevent cervical cancers caused by these strains of the virus later in life. According to WebMD, if you have never had chickenpox, you may avoid getting the virus that causes both chickenpox and later shingles by receiving the varicella vaccine. Non-vaccination can lead to a reintroduction of once rarely seen diseases. According to USA Today, non-vaccination was responsible for the largest measles outbreak to occur in the U.S. in 15 years. According to vaccines.gov, immunizations protect future generations. Vaccines have reduced, and in some cases eliminated, many diseases that killed or severely disabled people just a few generations ago. For example, smallpox vaccination eradicated that disease worldwide. Your children don't have to get smallpox shots anymore because the disease no longer exists. Because of vaccinations against rubella, birth defects associated with that virus are no longer seen in the United States. If we continue vaccinating now and vaccinating completely, parents in the future may be able to trust that some diseases of today will no longer be around to harm their children in the future. According to UNICEF, only one disease has been completely eradicated by vaccines so far. Many are on their way out. Smallpox has been eradicated by vaccines. Polio is close to being eradicated, with 80% of the world's children being immunized and incidence rates dropping to 90,000 by the mid-1990s. Chickenpox was a common childhood illness not all that long ago, but since the introduction of the vaccine, chickenpox is rarely seen in children in the developed world. And as you can see by this chart, this would be the annual deaths if there were no immunizations. This is the number of them prevented. This is the number of them still occurring, and this is the percent prevented. So as you can see, smallpox would have 5 million people dying if they were not immunized before the disease was eradicated. Because the disease has been eradicated from vaccinations, we have prevented 5 million of these deaths, which is 100%. Diphtheria would have 260,000 deaths. We've been able to prevent 223,000 by vaccines. There's also information for whooping cough, measles, neonatal tetanus, hepatitis B, tuberculosis, and polio. And as you can see in this graph, it's got the same information, but you can really see that the incidence rates have dropped. The yellow or orange here is the annual deaths with no vaccinations, the blue is the prevented, and the pink is the still occurring. So as you can see, there's nothing left occurring for smallpox, hardly anything for diphtheria, or for polio, with cases of lifelong paralysis. In conclusion, if you want your children to lead long, healthy lives free from preventable diseases, then vaccinate your children according to the timetable established by the American Pediatric Association. Today I've discussed why vaccination is important, the most common myth that persists involving vaccinations, and how vaccinating can be helpful in the future. Many children around the world do not have easy access to these life-saving vaccinations, but in the United States, we're fortunate enough to have easy and reliable access. Please take advantage of these vaccinations. It could save your child's life.